Hello, welcome back to my channel. I am Nurse Marsha. Today I want to give my 2 cents or my opinion about the nurses who created that TikTok video and they got fired from their jobs at Emory University in Atlanta, Emory University Healthcare in Atlanta. I understand they have more than one location there in Atlanta, but I like to put in my 2 cents. That video was crazy. That video was bad. And I've been around for a few years as a nurse, okay? I've been around for several years, over 20 years in nursing. Well, when I started, there was no social media, but I know a little bit something about nursing, okay? And let me tell you, I agree. I totally agree with them being fired. If I had been their supervisor, they would have been fired as well. So let's talk about what they did. What they did that was so inappropriate and why Nurse Marsha thinks, and I agree with them being fired. Nurses, registered nurses are given a license. After you take the test, you pass the test, you are given a license to practice yet as a registered nurse in the state where you carry that license, okay? When you get your license, your life changes. The way you carry yourself, the way you conduct your day-to-day business, it changes, or it should change, okay? You can no longer move in the same way you did before you became that professional. Because now, as someone that carries that license, you have a standard. You have a standard that you must practice according to the nursing standard. And the American Nurse Association, that is the institution that give us our standards. I don't know what they're teaching in nursing school now. Seems like, I don't know, maybe they're not teaching or maybe they're not covering the standard of care like they did a long time ago when I went to school. But let's talk about it some more. I'm going to kick you a little knowledge, and I'm talking to the younger nurses out there, okay? I have been a nurse consultant for the state of Michigan where I live. And one of my duties was when the nurse had a complaint made against her or an allegation of abuse, neglect, inappropriate behavior, what the state of Michigan does is they consult with someone like me, real live nurses, and they say, hey, take a look at this complaint and let us know if this action or practice was at the standard of care for nursing. So we take a look at the standards of care and practice from the American Nurse Association. So that's what I used to do. So I know a little bit something about this, okay? One of several standards of care and practice is ethics. There is a standard of practice and standard on ethics, okay? Under the ethics standards are several practices that you must maintain in order to level up. Practice at that standard. In my professional opinion, I would say that the nurses violated several ethical standards and practices. One of the biggest standard is the RN must practice with compassion, respect, dignity, and worth of the patient. I don't think they did that. It also tells us that the nurse must safeguard the privacy and confidentiality of that patient. They did not demonstrate this. They did not demonstrate or they did not practice dignity, respect, worth of the patient by putting that crap on TikTok, okay? That amounts to a person is down the hall or a person is in the next room and you're in the next room and you're talking about them behind their back. That's what that pretty much amounts to. Even though they didn't say the name or the date of birth or the address, they gave none of those types of identifiers. But basically, they were talking about the patients at the desk, and I'm sure some of them could have heard them, and then they put it on social media. That's bad, okay? So, they did not practice compassion. They didn't show any compassion for the patient. They did not respect the patient. They didn't show no dignity for the patient. They violated their dignity and their worth, okay? They did not demonstrate a professional safeguarding and confidentiality of the patient. And they did not show one of the other things that we must do as registered nurses. We must always demonstrate a professional responsibility and accountability for the nurse practice as a whole, okay? This carries a lot of weight as a professional nurse. Getting that license, like I said before, changes your life, okay? You're supposed to walk differently, talk differently, and act like a professional at all times, okay? In your professional as well as your private life, even at the grocery store. You may say, well, they didn't give the patient's name, address, telephone number, social security number, all of these common identifiers. But check this out. Just imagine if I just had a baby at Emory, one of the Emory hospitals. My friends, my families, my co-workers, my neighbors know I just had a baby at Emory. Hey, where did you have your baby? Oh, I went to Emory. Then they see or they hear what the nurses did talking about some women who had babies at Emory. The people that you know could assume that, hey, Marsha, are you the woman they were talking about? I know you had your baby at Emory Healthcare. Could you be one of the people they were talking about on the TikTok? Yeah, that can happen. Okay, it does not always have to be an identifier from names, numbers. That is why they did not uphold the confidentiality of their patients there at Emory Healthcare. It's such a thin line, people. Nurses, I'm talking to you, young nurses, just in case they didn't teach you this in nursing school. It's a thin line, and if I were you, I would err on the side of caution, okay? And I would just be a professional in my everyday activities. Did you know that every year the Gallup takes a poll and a survey of the most trusted professionals? I'm talking about professionals such as doctors, lawyers, teachers, police officers. Did you know that nursing or nurses rated number one for 20 consecutive years as the most honest professionals? Nurses are the most honest professionals. We are the ones that most people trust, okay? Nurses are trusted more than their doctors. So what these type of videos do is undermine the nursing profession by putting us at risk of no longer being trusted, no longer being honest, being perceived as honest and trusted from the consumer, the healthcare consumer, our patients, because that's what they are, consumers. Now, because of this negativity that happened at that Emory University knows that they may lose some patients or healthcare customers because of that negative TikTok. So when we operate as nurses, we have to operate and we have to protect our whole. It's bigger than just you and me as an individual nurse. We also must protect our whole profession. Okay? So in other words, we must think. We must be considerate of other nurses, because we've heard in the news lately that nurses have been protesting, not only in this country but across the globe. They have been protesting for better conditions at work, for safety conditions at work, for more pay, and a good nurse-patient ratio so we can do our jobs better. So this type of activity on social media, talking about people, I mean, just like what you learn in the kindergarten, that is not nice, okay? That's not nice to be talking about somebody in the other room, and it's certainly not nice to be putting it on social media. I totally agree with them being fired. And I'm telling you, what else is going to happen? Emory Healthcare System has turned over those nurses and have made a formal complaint with that governing body in Atlanta, Georgia, that issues license for registered nurses. And then those files are going to come to someone like me in Georgia, a nurse consultant. That nurse consultant is going to pull up the standards according to the American Nurse Association, and they're going to write down their summary if they think this was below the standards or above the standard. And yeah, I think they failed. So leave a comment below, subscribe to my channel, and again, thank you. Until next time, bye.